My name is Deb Ellsworth from the Elizabethtown College Healthcare Management class, and I'm here today to talk about WellSpan Health and identify some of their key stakeholders, the stakeholder expectations, and some metrics that might help to support some of the stakeholder expectations in the organization. WellSpan Health is a nonprofit healthcare entity that boasts 6 hospitals, over 130 individual patient care sites, which provide services ranging from ambulatory care, primary care, rehabilitative therapy, pharmacy services, laboratory services, and durable medical goods. Additionally, there's over 1,000 providers in the WellSpan network. WellSpan provides over $126 million annually in uncompensated care to the public. WellSpan Health has many key stakeholders. 5 that I have identified include the board of directors, the patients, the payers, which is the insurance companies of the system, the providers, and the federal, state, and local government. The board of directors may have expectations regarding how the entity serves the general public, how high patient satisfaction is, and also is the organization fiscally responsible so that it can maintain sustainable growth as the population's healthcare needs change. The next stakeholder is the patients. The patients are the center of healthcare. Without people having the need to seek healthcare, there would be no healthcare organization. Patients are going to have expectations such as having reliable healthcare, having it readily available when they need it. They're going to want accurate diagnoses. They're going to want to be safe. They're not going to want things like medication errors, and they're going to want to be treated with dignity and respect. The next set of stakeholders are the payers. These are the insurance companies, and in essence, insurance companies basically do fund the healthcare organization. So they have a stake in the organization, because if the organization does not properly manage their costs or negotiate contracts that are beneficial to the insurance companies, then the insurance company is not going to make a profit. And if the organization does not comply with the expectations of the insurance companies, the hospital may not get paid. And that's talking about things like pre-authorization and terms of billing for services. The next group is the providers. The providers have a stake in the organization because that's how they make their money, treating and healing people. So the organization, their expectations are going to be for the organization to provide them with what they need to do their jobs effectively. The appropriate level of support staff, the best equipment and supplies to perform their medical duties, as well as fair compensation for the work they provide for the organization. And finally, there's federal, state, and local governments, and their expectations are going to be that the hospital or healthcare organization is following the statutes and laws in place in regards to healthcare to keep the general public safe. Out of all of these stakeholder expectations, the most important, the ones that should outweigh the others, are any that are tied to patients and patient cares. Because as I mentioned before, the patient is the center of the organization. Without them, the organization cannot exist. So whatever we can do as an organization to promote the health and wellness of the patients is in turn going to be beneficial to the organization and also to other stakeholders. For example, if we don't correctly diagnose a patient and they have to keep returning for visits, it's going to affect our providers, our resources. It's going to affect the payers. It's going to cost them more money in order to make the patient well again. It's going to affect the public image, which will affect the board of directors, and it could even call into question if we're following the statutes of the federal, state, and local government because we're not providing effective care for the patients. So things like patient satisfaction, patient safety, accurate diagnoses, things like that are probably, in my opinion, some of the greatest and most important expectations on the stakeholder list. Some examples of metrics that could be used to help track some of these stakeholder expectations include the HCAHPS survey, which is the Hospital Consumer Assessment and Healthcare Providers and Systems Survey. This survey covers many different facets of patient care. It's given to patients after they have had a visit at a hospital or a rehab center or a primary care doctor, and they assess the level of care they received in several different categories. This is considered by most hospitals the gold standard for measuring whether or not they are meeting their patient expectations, and it has been shown that the top 25% scoring hospitals also have the best clinical outcomes and the highest level of profitability, as well as the most patient-centered culture. The other metric is sentinel events, and this also ties back to patient safety. A sentinel event is identified by JCAHO as any event that results in death, permanent harm, or severe temporary harm that requires intervention in order to sustain life. The number of sentinel events a hospital has obviously clearly ties to their level of patient safety, which affects the patients, the providers, the state, federal, local governments, and also data collected from sentinel events can help to prevent any future sentinel events from occurring in the future. That is a brief overview of WellSpan Health, their stakeholders, their expectations, and some metrics that could support their expectations. Thank you.